Hi, I'm Sandy Lopez, and I would like to give you a tour of our medical lab and share with you some information about our program. Now, think about when you've been at the doctor's office and the medical assistant calls you to go back to see the doctor. Now, they're going to ask you some very important questions, such as, what brings you to the doctor today? We call that a chief complaint. They're also going to ask you about medications that you take and any allergies to medications that you have. They're also going to take your vital signs. They're going to take your blood pressure using this device right here, which is called a sphygmomanometer. We like to say blood pressure cuff for short. It's much easier. We also use a stethoscope. They're going to take your pulse, where they feel your wrist, and also count how many times you breathe in a minute, which we call your respiratory rate. They're going to take your temperature using a thermometer. And they're also going to get your height and weight. Now, a lot of people don't like to step on the scale, but it really is an important piece of information for the doctor. Not only for your overall wellness, but in certain medical conditions, it's very important for the doctor to know whether or not the patient has gained weight or lost weight. You're also going to study the human body, and we are going to cover the human body from head to toe. 11 body systems. We're going to talk about the skin. We're going to talk about the digestive system, the cardiovascular system. And for example, we are going to learn about the heart and its 4 chambers and how it pumps blood throughout your body. Now, if you've ever been to the doctor, a friend or a family member with chest pain, you may have had an EKG. And an EKG is something that a medical assistant is going to perform. So an EKG, or an electrocardiogram, is going to be something that the student is going to learn how to do. So in the office, you will learn how to hook this machine up to the patient, putting electrodes in very precise locations and hooking up some wires. Now, the EKG is going to give the doctor very valuable information about what the patient's heart is doing, what it has done, and it will also let the doctor know if your patient is having an acute or sudden cardiac event that may be life-threatening. And if it's not, then the doctor will look for other possibilities of what the pain is being caused by. You're also going to learn about procedures and treatments. Now, have you ever been to the doctor with a terrible sore throat? Now, you may have gone in and the medical assistant will come in and they'll swab your throat. Now, it's not a very comfortable procedure. However, it's just very quick, but will give the doctor valuable information about what is going on. And more specifically, they're looking for the possibility of strep throat. So in the office, you can actually run a quick test to see if you actually have strep throat. So using a tongue blade and a culturette, and of course we'll have our gloves, we'll be able to obtain that sample from our patient, run the test in the office, and the doctor will know within minutes whether or not you have strep throat. Now, if you do have strep throat, your doctor is going to prescribe some antibiotics for you. And as a medical assistant, you will learn about pharmacology. Pharmacology is talking about learning how to administer or to give medications in the office, as well as prescriptions and also over-the-counter medications. Now, computers, very important in the medical office. And as you may notice, when you're in the office, that most offices use computers to record all of their documentation, to do patient appointment scheduling, which is also important for us to learn. So as a student, you will learn how to use electronic medical records so that when you get out into the field, you will easily be able to transition into the programs that are out there. Now, I talked a little bit about scheduling, and scheduling is important for medical assistants to learn. So we will learn how to do medical front office in regards to scheduling, some billing. We'll learn about the different types of medical insurance, as well as referrals and authorizations. And we're going to learn about coding, procedures and diagnoses. Coding I like to think of as the language that insurance company speaks. Now, do you remember that sore throat we were talking about? Well, when we go to submit that to the insurance company for billing, the insurance company, they're not going to understand strep throat. They are going to understand the code that you will learn to assign to that strep throat. They speak codes, they don't speak words, okay? CPR. Many people will come into the program having already taken CPR through their employer or through the community, which is great. In the program, you will also have the opportunity to take CPR again, but this time as a healthcare provider. Now, safety in the medical office is very important, not only in the medical office in general, but also in the lab. As medical assistants, you will learn how to administer injections as well as draw blood. Now, drawing blood isn't only about obtaining the sample from your patient. It's also about preparing the sample to go to the lab. So for example, when we draw a sample from a patient, we then have to process it. So in that, we use an instrument called a centrifuge. And what this device does is this spins the blood sample very quickly. And by doing that, it will actually separate the blood components. And these are some examples of some of the tubes that we'll use to collect those samples. Now, once that sample has been spun down, we can then send it off to the lab. And the lab then will analyze those results, and they will send those to the doctor so that the patient can be taken care of. Being a medical assistant has some amazing opportunities. Every day, students will have the opportunity to learn. They will learn in lectures, they will learn through classroom activities, they will learn computer assignments, and they'll also learn their hands-on skills. Medical assistants out in the field have opportunities where they can grow within their own organization into supervisor or management positions. They can also advance their careers, and many look at this step in their life as a stepping stone into more advanced health careers, such as registered nursing. Certification. Some students will decide that they want to become certified, and graduates may be eligible for national certification, which is optional, but they may choose to do so. At UEI, not only will we prepare you with the knowledge about the human body, the procedures, the treatments, the computer skills, as well as the hands-on skills in the clinical lab, but we will also prepare you with the professional skills that it takes to be successful out in the medical field.